Hello, everyone. I am Dr. Bayo Winchell, or Dr. Bayo. I am so excited to be here today with blackdoctors.org and to highlight high blood pressure and provide more information about my recent viral video about high blood pressure and the recommendation and protocol for treatment for Black individuals versus everyone else. So, to just set the tone and the stage. I'm a family medicine doctor, urgent care, as well as a medical director for a couple of healthcare systems. But my love and my passion is advocacy and health literacy, and really sharing information in a bite-sized format in hopes of helping as many people as I possibly can. And I'm a practicing physician, and I speak nationwide on a wide variety of topics, all centered on helping people feel informed, helping people be able to advocate for themselves in any period of time when they're seeking care. That is my joy. That is my love. So I always also like to share, I can't give any direct medical advice, but excited to highlight this topic in hopes that everyone listening is able to find a takeaway. So next time when you see your doctor, clinician, any sort of healthcare professional, you have different ideas, suggestions, and takeaways to advocate for yourself. So let's get to it. I'm hoping there's a lot of people joining, and please feel free to ask any questions. I love questions, whether you see me in the clinic or you see me speaking in different states. I welcome it, because my goal is to really answer as many questions as I possibly can. I always put myself in the thought process of, if I was a patient, what would I want to know? I would want to be able to know as much information as I possibly can, as well as I'd want to have a space that is open to questions. That is huge. So we're going to get to it as people join. So I recently posted about high blood pressure. So when we talk about high blood pressure, we often just hear about it, how it has impacted the Black community. And so high blood pressure is a condition where you may or may not know that your blood pressure is elevated. Often we hear about it being connected to increased risk of heart disease, increased risk of other complications if you have diabetes or other things as well. But it can also be a silent condition where you may not know your blood pressure is elevated. And when it's elevated, it really puts a stress on your heart, on so many different parts of your body. So the reason why we're talking about high blood pressure and this recommendation and protocol, there has been a policy that has been in place for a number of years, and it's something that I've been advocating for change since I can't even remember for how long. And so the current recommendation is for Black individuals, if you have high blood pressure, there are two classes of medications recommended, and they are classified as thiazides and calcium channel blockers. So when I share this information, people often say, well, that's great, because shouldn't Black individuals get a different type of medication than everyone else? Well, my answer is no, because when we look at the definition of race, it's important to highlight how this practice is harmful to us being able to have our blood pressure controlled, to have the best care possible. And it's limiting us based on our race, because I always share race is a social construct. So I'm going to pause there and just see if there's any questions before I delve even deeper. If there's any questions, please feel free to put them in the comments. I know I'm going to have help so I can see your questions come up. And once again, I'm going to reintroduce myself again for those who've just joined. And I'd also love to know, where is everybody from? Comment. I'm actually in Reno, Nevada. I always like to highlight, people always think Las Vegas, but I'm in Reno, which is really close to Lake Tahoe, which is beautiful. So drop a line, let me know where you're from, what city. I would love to know. I want to know where everybody is joining from. So I think I saw something from North Carolina. Anyone else? Yes. Sippy, I love it. Anyone else? The West Coast. Hey, West Houston, Texas, Sharon Walton Denby. Thank you for Las Vegas. Fantastic. And I always share, people are surprised. I'm actually born and raised in Reno, Nevada. I have lived different places. I've lived in Chicago, New York, Florida, all and including out of the country. I lived in Dominica in the West Indies. I don't know if there's anyone from there joining us. I lived there for 2 years. Yes. Okay. So continue to chime in with questions. I do not mind being interrupted. I want to know what things I can help with. Again, I can't give any direct medical advice, but feel free to place a comment. So once again, I'm Dr. Bayo Curry Winchell, which is a long last name. So I just go by Dr. Bayo, which is a lot easier. And I'm from Reno, Nevada. I'm a family medicine doctor, urgent care doctor, and sexual assault response doctor as well, and a medical director for 2 hospital systems. But my love and passion, as I mentioned before, is truly health equity, maternal health, and advocacy, in hopes of everything that I know as a clinician, that I can share it forward to as many people as possible. I'm also a speaker across the country. I have a series called Beyond Clinical Walls. You can also find it on Instagram, dr_BCW. And so you can find extra information. So now we're going to delve back into the protocol. So I mentioned high blood pressure, and there is a protocol or recommendation for Black individuals. This protocol was based on the assumption that Black individuals would process a medication differently, that they should only have 2 classes of medication versus everyone else. And those 2 classes are thiazides and calcium channel blockers. And it's important that I mention, when I mention those 2 classes, there are several types of drugs underneath those 2 classes. And why this protocol is harmful is when you pick a specific race and say, you may only, or you should only have 2 classes to treat your high blood pressure, we are missing the mark on all of the other blood pressure medications that could potentially help that person. So I'm going to give an example, because I think when you give an example, it helps you kind of think of a friend, a family member, or even yourself. So you go in to the doctor and you are told that you have high blood pressure and a certain medication is recommended. I'm going to stop there. So often when I say that, people ask, are you the type of physician that only recommends medications? I am not. I believe that it is your health journey, and I'm just there for the ride. And my goal is to share all options with you and then listen to what you would like. And that part is so, when you know me, and any person who has met me in my clinic knows that I am just part of it. And finding a physician that honors and acknowledges what is important to you should always be at the forefront, because it's not about me sharing, you should be on this medication or you should do this specific thing. It's about sharing all the options. So I always like to point that out. So back to the example, you go in, you're told that you have high blood pressure. And in the perfect world, you are all options are shared with you. And you have decided that you would like to know more about a medication. Well, a clinician who has learned this protocol that I mentioned about the 2 classes has learned that based on the color of your skin, that I should recommend 2 classes of blood pressure medication. not based on your individual health, not based on anything else but the color of your skin. And I remember when I learned this in medical school, and I said, why? That makes no sense. Because when you look at the organs inside the body, they are the same. And the color of someone's skin, which is a identifier, it is not my ethnicity. Ethnicity is different than race, as we all know. I'm Black, but that doesn't make me African. And so when we limit our thoughts on the diaspora of all of those things that make up the Black community, we have missed the mark. And I did a TED talk about this several years ago titled, Why Don't Blacks Trust the Healthcare System? And I encourage everyone to please take a look at it, where I highlight so many different things that have not been talked about that really impact our community. And it was my honor to highlight the things that were taught to me, the things that I said, I don't understand why we are recommending this. And I don't understand why we're not stopping, because it's harmful to state one group should only have this, a specific piece. So I'm going to pause there. I just want to see if there's any questions as I delve a little bit deeper into this protocol and recommendation. And again, feel free to ask any question and to shout out where you are tuning in from. Okay, so you have gone to the doctor, you have been told that you have high blood pressure, and a medication has been recommended to you, and it's part of those two classes. Well, imagine you start taking this medication, and then you realize that your blood pressure still isn't under control. You go back to that physician and you share, my blood pressure isn't under control. Well, based on the protocol or the recommendation that that clinician has learned and continues to learn, they're going to either possibly say, oh, let's up that dosage, or let's try this other medication in conjunction with the one you're on, or try this other class. Well, why shouldn't you be able to try all of the other medications? Or why shouldn't you know about all of the other medications? And it's based on the color of your skin. And we hear as Black individuals that we are at the highest risk or rate of dying from kidney disease. And one thing I like to really put into detail is, how do you get sometimes kidney disease? It's when your blood pressure is not under control. And so if your blood pressure isn't under control because you were limited on a specific type or class of medication based on just solely the color of your skin, think of how many people have developed kidney disease because they weren't given all of the options. And so when I did my first TED Talk several years ago on this topic, I have made it my mission to continue to share this information, to continue to put it out there. And I also have videos about this on Instagram. You can find it. There's a blood pressure series where I highlight the medications. I highlight all of the things that I I feel and I know that everybody should have the right to know about. So I'm going to pause there. I've got more information as well, but again, feel free to drop in a question, a comment, anything that I can highlight even more in respect. While I'm waiting for that, I'm going to give you more information about who I am, why I do what I do, and what drives me. So, family medicine doctor, urgent care doctor, and sexual assault response team doctor as well. Well, the reason why I do what I do, all that credit goes to my father, William Curry. And you can hear in my voice why I get emotional when I mention his name. So he recently passed away. He was 99 years old. He was a World War II Korean and Vietnam War veteran. And his hat is actually right behind me. And so I grew up going to different events, different rallies as a kiddo, advocating and holding up signs. And I didn't know what I was there for, but I did know that I was standing up for something. And so that has become my blueprint, my North Star in what I do. And so when I had the opportunity to become a physician, I thought, what can I do to share health information as widely as I possibly can and put forward the information I have and put it in the hands of my patients and even those who aren't my patients, because the more you know, the more you can advocate. And for me, I thought if I can break it down in a way that anybody can feel informed, why not? So it has been truly my honor to help, and to help people, and that's why I do what I do. I'm gonna pause and just see if there's any other I can't see if there's any questions, so I apologize if there are, there may not be. But I will pause and just see if there's anyone else who, would like more information. So on my Instagram, you can find a whole series of topics, even beyond high blood pressure, on ways to advocate for yourself. I talk about a playbook. I talk about all different things that can be really vital in helping you advocate for yourself, whether you are there with a loved one, whether you are seeking care, and things to know. Another topic that is really near and dear to my heart is women's health. That is something that I have personally experienced as far as dismissal. And as a Black woman, or, all of these intersectionalities all of us carry as people of color, it's really important to me to highlight how, as individuals, even regardless of gender, that we are often dismissed or told that we're not in pain, or subjected to what pain looks like or what pain should feel like. And that is another topic that I'm really um, passionate about. So, another thing that I want to jump back into as we go back and forth is high blood pressure again. I want to sprinkle in more information. So, the things that I find very vital, I think, to health, and I mentioned it earlier, is there shouldn't be a one lane for your health, whether it's blood pressure, diabetes. It should be about you and what you would like. And so, some of the things that I talk about with my patients is creating that. Um, Health sheet or that playbook of different options to really treat high blood pressure. So that can be number one, looking at what foods might be causing an increase in your blood pressure. Another thing is stress. And often when I say that, people are like, how do you even get rid of stress? And you can't, because it's something that we deal with from the time we go to bed to the time we wake up. But one thing I share, which is, I think, a surprise to a lot of times when people hear me, I say, find or think about one person, place, or thing that you know triggers you, that you know is something that is not good for your mind, body, and soul. And when that person thinks about it, I share, every time you are facing that, your blood pressure is going up. When your blood pressure goes up, it stresses your heart. When your heart rate is up, it can be very difficult to concentrate. It can also be a stressor on your mind. And so when you dissect that, or um, kind of layer those areas, it's really helpful, and it's very easy to think about how everything is intertwined or connected. And so thinking about those kinds of things and how that could be a cause or a contributing factor to high blood pressure is so important. So I encourage my patients to think about their stress level, their food, all of those things. So I'm going to pause and just see if we have any questions. Oh, we do. Charles Hughes. Thank you, Charles. How do you feel about garlic and lowering blood pressure? How do you feel about garlic lowering blood pressure? I think it's fantastic. I'm very open to all areas. I think often we miss the boat when we think that it has to be one way, where it has to be medications. There's something to be said before medications were even at play. What was helpful to people to lower their blood pressure? What was helpful as far as things that are part of our food source, part of different herbs, all of those things can play a role. And again, I can't give direct medical advice. I always say it's important to consult a healthcare professional that you trust and that's been vetted. But I believe in all of those things. I think are very can play a role. And just for those who have just joined, I'll share and I'll continue to share with my patients. I'm all about what is important to you. What would you like for your overall health? Because it's not about me, it's about you. And I believe in that. And that's how I practice. I think I had another question from Sharon Walton Denby. Yes. What are the effects of high blood pressure on the eyes? Thank you for that question. So, as I mentioned, high blood pressure can often be a silent disease where you may not feel that your blood pressure is elevated. And unfortunately, high blood pressure can impact your vision. Some of the patients that I see that come in and they don't know that they have high blood pressure, they'll share that they were having some vision changes. Often it's some blurred vision. Sometimes it's this kind of feeling like, are they tired? Are they fatigued? Why do their eyes, why do they feel so heavy? That's been a common presentation, but the effects can be quite damaging on the vessels. And when the vessels are damaged, when you've got this high velocity or speed through those, it can, unfortunately, we think of hardening or issues with the vessels of the eye, and that can impact your vision. Um, and so I think I have more questions. Good evening, doctor. Hello, Sheila Neal. Do sinuses play a part in blood pressure? So I'm going to, I hope, and if I don't answer this correctly, let me know, and I want more questions on that. So yes, they can. So I'm going to give a where I'm coming from, and you let me know if I missed the boat. So I see patients who have what we call a sinus infection or sinusitis. And so, what that can be attributed to, sometimes it's viruses, sometimes it can be a bacterial infection, and sometimes it's allergic in nature. All of these things can be a role. And so, if you're if you have an infection, a sinus infection, and you take like an over the counter decongestant or an antihistamine, that can unfortunately raise your high blood pressure. The other thing, from just a natural piece, if you have a sinus infection, often you feel really congested. And when you're congested, you may not sleep as well. You may have a higher stress level just because of that congestion. So, all of those things can unfortunately raise your blood pressure. And another thing I think people don't talk about when it comes to sinus infections is anatomically. So, you've got these pockets in the face. See, I love these questions because I'm all about. And so, if the sinuses are actually blocked and you take a medication, and it's blocked where it's like in these pockets, that medication may help it for a little bit, but that sinus infection is going to continue to happen. So sometimes with some of my patients, I actually have to get a scan, and then I find out that they've got chronic, which means long-term sinus infection because of the blockage. And some patients have had to actually get that fluid removed. And when that happens, they don't need medication. They don't need anything else moving forward. And unfortunately, I've seen patients where they've been on rounds of antibiotics just trying to figure out why this sinus infection continues to happen, but they haven't been, or it hasn't been shared the opportunity to actually get a scan and see, is there a blockage? So I love that question, and so forth. So, and then I might have more. Please continue to drop in where you're from, where you're calling in from. I would love that. Oh, more questions. So, Christina Jones, what are some natural remedies to lower your blood pressure? I love this question. So, everybody's an individual. As I mentioned, I am big on when I see a patient, it's not just medications. And when it's natural, I do the same thing as far as leaning into what are the natural things that you would like to know. So it's important that I mention that, because whether it's on the medical side, a medicine, traditional, and I don't like that tradition is partnered with medicine. I just want to highlight that, because I think whether it's natural or medication, it should be a traditional form of medicine, because that umbrella should include everything. So the things that I love are different herbals. I think are fantastic. And again, I can't give direct medical advice, so it's important that I mention. I think. Chamomile is a really amazing tea that I love. And I think I've had patients where they're having a hard time falling asleep. And when you don't sleep as well, that does increase your risk. Let me be clear, when you are not getting enough sleep, that can increase your risk for heart disease and other factors. And so with some of my patients, just having tea to help you relax and kind of get that reset before you go to bed, that is really powerful in that overall longevity of your health, including lowering your blood pressure. So that's one that I love. I love certain foods that we talked about, garlic and other supplements, I think can be very helpful. The other thing I always like to highlight when I talk about natural remedies or natural things in our body, if you choose to consume something, I always like to share. Unfortunately, there can be manufacturers who are not telling the truth. They are sharing that there's something, that they have something in their bottle or product or vitamin, and it's not accurate. And sometimes we can have a little of too much or too little in that because it's not regulated. So I share to all my patients, make sure you thoroughly look and trust that manufacturer. Look at reviews just to make sure. About 9 months ago, we it was shown that the melatonin gummies, kiddo gummy or pediatric gummies, had 10 times the amount of melatonin in those gummies. And so we were seeing in the hospital, in the clinic, these kiddos who were so drowsy, and it was because unfortunately certain manufacturers had an excessive amount of melatonin because it's not regulated. So I just want to highlight that piece, that whatever you decide to consume, just check, check, check. And that's on all areas. More questions I want to make sure I get to. Any other questions? And again, drop a line where you're from. I'm going to reintroduce myself just in case if someone has just joined. I'm Dr. Bayo Winchell, extremely long last name. But Dr. Bayo is what I go by. And I'm a family medicine urgent care physician, and as well as a sexual assault response team medical director. And health equity and health literacy is my passion. It's my love. Health equity for me means all health. As a family medicine doctor, this might be not everybody knows. I get to see, and I use my words very intentional. I get to, because I love being a physician. I love seeing patients. So I say, I have the opportunity to do this. And I often share with my medical students and my residents that for me, this career brings me joy, and we should honor our opportunities, meaning myself as a physician and my medical students and residents, the opportunity to connect with patients, whether it's a celebratory moment, like giving birth or something like that, or if it's in a somber moment. I cherish that. So family medicine, urgent care physician, and I see all ages. So I've been trained in whether it's delivering babies to seeing, I don't use like the word older, I like to call it we've lived our life. We've lived some life and more life to come. So I get to see all ages. So I'm going to pause there if there's any questions. Oh, one thing I forgot to mention is journaling. That's another thing that I recommend to my patients. I share the power of journaling. And now, this part you might not have heard of because I know everyone thinks of, oh, yeah, I'm supposed to write things down. Well, you can write it down. You can also type it in your phone, but you could also just record yourself. That's a form of journaling that I think we forget of. First of all, if you're experiencing an illness, a symptom, a condition, just memorializing or recording it so it can live somewhere. So you remember on this day, I kept having more headaches, or on this day I felt more tired, or certain things of that sort. And then journaling those symptoms, those conditions, those conversations that you've had with those with certain clinicians. That's an important piece because in the end, that journal is your health. That journal reflects what you've gone through, who you've spoken to, who has honored you, who has dismissed you, and it allows you to advocate for yourself each time you seek care. So I'm a big fan of journaling. I'm going to pause there. And I know we only have about 10 minutes left. And I'm going to pause for a question. And I've got another thing that I think is super important when it comes to keeping track of your blood pressure and how often I recommend as far as taking those readings. Any other questions? Andrew Smith, I like to record and play back while driving. Recording affirmations also. Yes, I do the same. So in my family, affirmations are huge. I have got, I didn't mention this, I have two little girls. So I'm a mom and a wife as well. And in our family, affirmations are huge. And being able to your point, play it back and have that sense of like, a gift, not even a gift to yourself of what is important to you, what you might be experiencing, how you can get through it. And that piece is also a form of healthcare. And I think we forget that it doesn't have to be in the clinic. It doesn't have to be in a certain way when we talk about health. Healthcare is all areas of mental, physical health, and affirmations are huge in my family. So, blood pressure, I'm going to talk a little bit more about that. And I have another. I hear often that lisinopril is very bad for African Americans. Your thoughts? Thank you, Lisa, for the question. So, again, I can't give direct medical advice, but I am going to share this. So, I had mentioned those two classes of blood pressure medications that are recommended, thiazides and calcium channel blockers. So, when you think of lisinopril, there's another class, ACE inhibitors and ARBs, angiotensin receptor blockers. Now, I've given you 4 classes. I'm going to repeat those again, and I'll explain why. So, ACE inhibitors, for anyone who's listening right now, just to write it down. Then I mentioned calcium channel blockers. And then I also mentioned angiotensin receptor blockers. And I hope I feel like I'm forgetting one. Calcium ARBs, ACE inhibitors, and there's one more, and I apologize, it'll come back to me. So under those are different classes. And as you mentioned, Lisa, lisinopril. So there's this thought that lisinopril is bad for a specific race or ethnicity. And we talked about the separation of those two. For me, it's about that individual patient. I need to invest in your overall health status. By that, I mean, do you have kidney disease? Am I trying to be protective even more of your kidneys because of diabetes or other things like that? If we decide to choose a medication, and I say because again, it's your choice and I'm just the person to help, with it. It is not me. If you share that this is something you would like to do, I believe in individual. I do not believe that a certain medication should be good or bad based on someone's race and ethnicity. Because when we look at the fact that our organs are the same, now the color of my skin is a definition of race. And again, you can be of Caribbean, you can be of so many different things. And the fact that the protocols or the recommendations, whether good or bad, are based on the color of my skin, not my ethnicity. And I'm going to go a little bit deeper. Some of the recommendations, like you mentioned, are based on clinical trials where they have studied specific groups and made these decisions. Well, the problem with that is you have collectively said something is good or bad based on who entered the room and what the color of their skin was, not their ethnicity. So, to make a decision on what is bad and what is good for a medication based on the assumption of the color of their skin, sh- that should not play a role. And so I think there's more work to be done because we don't really know, because we've only taken the color of people's skin, not their ethnicity. So that part, I hope, let me know, Lisa, if I answered your question. And I'm more questions. I know I'm only have like about 3 to 4 minutes left. So I'd love if there's any other questions, please let me know. And again, I'm Dr. Bayo, and you can find me on Instagram. I'm dr_bcw. Please check it out. There's a plethora of videos of advocacy, different topics, different things as well. And I have 2 TED Talks out. One is Why Don't Blacks Trust the Healthcare System, which really highlights different things for the Black community to know about how to advocate and different race-based algorithms. And I've been doing this for, I didn't share that. So I've been a physician. I graduated in 2012. I've been a doctor for a long time. And this piece of advocacy with race-based, all of these things I've been doing this whole time within communities, social media, and so forth. So each time I have the opportunity to share on social media or share in a speaking engagement, I'm grateful because it really is just an amazing opportunity to do what I love, whether it's in the clinic or outside the clinic. So I have a from Kim. I am a person that has an adrenal issue where it runs too high. What is a great medicine for me? So I'm not able to give direct medical advice. What I would like to share, and it's not because I'm not able to, is I would love for you to, when it comes to your adrenal, because it could be high or low, I would love for you to write down all the medications, or if you've been on any medicines, when your symptoms started, where your symptoms are now. And I want you to have that, whether it's in your phone or and so forth. And then when you see your physician, I want you to ask them, based on this, where I've come from, what I'm feeling now, I would love to know, or I want to know, all of the medication options that could be helpful for me. I don't want to know the medicines that you think are the ones that you think I want that might be. I want to know all of them. Why? Because we can't forget that bias can play a role in the offerings that we seek or when we seek care. And so being able to know all of it, so then you can research and say, well, what about this? What about this? And one thing that I have a video on that I recently posted, and please check it out. I talk about something that people don't always mention. Every time you see the doctor, we are trained to create 2 things in our 2 lists in our minds. And it's what we think this could be, whether it's a disease, illness, symptom, and what we think it can't be. And so it's called a differential diagnosis. And so I share with my patients or anyone that I meet, ask that doctor what they think it can't be and what they think it can be. And that's the same when it comes to your question. What medicines do you think I could have? And what medicines are you ruling out? And I'd like to know why. Because also in that situation, you have shared your information with that doctor, but we know sometimes you may not have been listened to, or maybe they missed out on certain pieces. That gives you the opportunity to say, no, remember, I shared this with my adrenal, either insufficiency or too high. Why couldn't we do this drug? So I hope that is helpful. And please check out the video too, because I think that also is a wonderful playbook of things that you can ask when you see the doctor. So it's already time, and this has been fantastic. I am grateful. Thank you, blackdoctors.org, for this opportunity to just reach more people. This is what I love to do. Again, I'm Dr. Bayo Winchell. I'm a family medicine physician, urgent care, and sexual assault response team doctor. I see patients. That part is always important to me. Why? Sometimes you hear about people who are doing amazing work, and everyone's out there doing amazing work. And for me, that work will always include seeing patients, because I think having that lived experience as a physician, as a practicing doctor, and then anything I put forward is so important. And the patients I see are, I would say, categorized as those who've been historically excluded, marginalized communities. I see everyone, and I love it. And so I highlight that even though you see me on social media, you see me on television, I see patients, and I saw patients today, and I love it. So once again, thank you for your time, your energy, the questions. This was fantastic, and I'm excited to continue to connect and hopefully help you on your journey in any way that I can. So, thank you, everyone. This was fantastic. And please check out those TED Talks as well. Thank you.